The Indigenous population of Australia continues to experience a collective trauma as a result of colonization. In this presentation, I explore the concept of transgenerational trauma, the importance of culture, and how a loss of culture has resulted in trauma. I then explain ways the trauma is being manifested within these communities and propose a plan of action. A study by Anthea Craig investigated the application of the concept collective trauma to Indigenous Australian communities to see whether it was respectful and accurate. The concept is usually applied to survivors of natural disasters. Craig found strong parallels between human reactions to natural disasters and war zones and modern experience within Indigenous Australians afflicted by colonization. This means treatment used with natural disaster survivors may benefit these communities. Trauma imposes symptoms including a mistrust of self and others, suicide, substance abuse, violence against women, unremitting grief, shame, humiliation, intergenerational conflict, role diffusion, cultural genocide, leadership crisis, and a conspiracy of silence. These communities have been subjected to brutality, bloodshed, massacres, disease, dispossession, and dispersal. The diagnosis of PTSD is given after a single traumatic experience. However, colonization is a continuous, ongoing process which results in complex trauma and is more difficult to treat. In regards to transgenerational trauma, it is important for a group to develop a forward-thinking narrative containing hope after a trauma is experienced. Otherwise, an unclear story prevents the group from mourning and moving forward, and the group is then stuck, which has been termed frozen ancestral trauma. When a parent is burdened with trauma and responds in silence, it then influences the child to be incapable of speaking about their emotional experiences. This is how the cycle of unprocessed trauma continues. Psychosis and schizophrenia are known to be genetic, but some theorize they are resulting from the transgenerational trauma. Pathological and antisocial behavior in these communities may be responses to unresolved collective trauma. According to Dr. Halloran, culture can be thought of as a complex and diverse system of shared and interrelated knowledge and practices of a society, providing structure and significance to groups within that society and to an individual's experience of his or her personal, social, physical, and metaphysical worlds. Culture is an effective human adaptation. It is essential in coordinating effective human interaction. For the individual, culture provides a validated way of thinking about oneself and a way of behaving in the world. Culture has also evolved to deter social isolation and existential anxieties. It gives meaning and value to our existence by creating relationships between individuals and society. In doing so, structure and order are also created. Without the meaning and value culture provides, an individual would have anxiety about life being only about survival and nothing else. People who have suffered from cultural annihilation will often live with emptiness within themselves and be unsure about the causes of the emptiness. Some argue psychotic symptoms are a result of frozen trauma within desperately trying to come out. People feel the need to defend their culture. The dominant group often enforces their culture over another group, as happened in Australia. Cultural trauma is when practices and knowledge within a culture have suffered and are no longer providing individuals with meaning. Because this has happened to the Indigenous community in Australia, they are more likely to suffer from anxiety and develop unhealthy coping strategies. The coping strategies are often hard to separate from, and these too are then passed down through generations. As a result of transgenerational trauma, Indigenous imprisonment, infant mortality, substance abuse, medical conditions, hopelessness, helplessness, disorientation, irritability, and insomnia have risen out of proportion. Indigenous are also 4 to 5 times more likely to die from mental illness. Collective trauma specifically results in gasoline sniffing, alcohol and drug addiction, domestic violence, suicidality, and sexual abuse in individuals. Because the larger society does not understand the historical base of the collective trauma, it is usually viewed as individual pathologies. It seems that the approach to healing the Indigenous collective trauma includes restoring cultural knowledge and practices. It is proposed that education incorporate Indigenous knowledge and language. In Hawaii, this has been found to have positive effects on children's education. Dr. Halloran believes the central focus should be on treating Indigenous health problems through Indigenous practices. The We Ali program strives to heal pain and trauma using traditional ceremonies. People who have gone through the program report significant emotional healing and a change in perception from victim to survivor. If a child is incapable of speaking about their emotional experience as a result of their parents' trauma, treatment first requires speech therapy for the child and the adult. Once the trauma in the adult has been treated, the children can then become well and the cycle of trauma can end. Another successful program is the Strong Women, Strong Babies, Strong Culture program. This program involves traditional food collecting, which increases exercise, and traditional pregnancy practices such as a smoking ceremony. The outcome includes a decrease in low birth weights and preterm babies.